My name is Ulrik Kirk. I am coordinator of the FEMaLe project. So I'm actually in this double position, being both the coordinator, communicating with our project officer in Brussels, and I'm also the project manager of this project. I'm situated in Aarhus in Denmark, affiliated to the Department of Public Health. So this is where we run the project from. And I have a background from humanities, actually, very much interested and involved in digital humanities. So in addition to the FEMaLe project, I'm also doing some research myself about video consultations in general practice. But yeah, I'll just share my slides. You can see them now in presentation mode. Brilliant. All right, so let me first introduce you all to the FEMaLe project a little bit. I've seen some familiar faces in the participant list, so that's very nice, thank you. And others, if you don't know much about this project, you have some time now to be introduced. The FEMaLe project is an acronym for Finding Endometriosis using machine learning. And it's a project granted by the European Union's Horizon 2020 Research and Innovation Program. And I think that's very exciting in the way that the Horizon program was set up actually to foster more innovation and really stimulate closer collaboration between universities and industry. So the FEMaLe project is actually based in this call about personalized early risk prediction, prevention, and intervention based on artificial intelligence and big data technologies. So as such, it's actually a very technology-based project. And the three main pillars that FEMaLe stands upon are actually awareness. And I guess Adrienn will tell you more about this. This is basically what we do to raise awareness, to do advocacy. We also have a strong core in the project about research, and Attila will explain more about that. And then, of course, we also have a strong emphasis on innovation. And this is where I guess both Adrienn and Attila will tell you more about this. We have an app in the project too. So in this picture here, we see the FEMaLe group we met in Aarhus for the first time earlier this year, actually. So that was interesting to do such a large project and then being able to meet physically for the first time after more than a year. But a very, very nice group of multidisciplinary researchers, many actors from universities, hospitals, civil society organizations, companies. So we are really nice consortium consisting of both multidisciplinary researchers, like I said, but also multi-level actors. So I think that's just one of the main things about this project, that it brings together a variety of great dedicated people from many countries across many interests, and I'll come back to this a little bit later. So what's the FEMaLe project about? Well, the main goal of the FEMaLe project is to personalize this early risk prediction of endometriosis with an aim to ensure a more individualized intervention and to build knowledge for prognostic prevention by the identification of subtypes of endometriosis. So that's like the overall goal with this project. As you can tell, this is very much related to the call about early risk prediction. So this is, of course, trying to align with what was expected by the Commission asking for proposals. Endometriosis, as you all know, is a very interesting case in this sense, because there's so much that needs to be done. So in this project here, we have also broadened out ourselves across both primary and secondary healthcare sector and across many disciplines of research, and therefore also innovation. I guess the interesting part on my behalf leading to this project overall was a white paper about how to use machine learning to, in this case, identify rare diseases. And even though endometriosis is definitely not a rare disease, but just very under prioritized and underdiagnosed and many other things, I guess that way of thinking about the whole project could be very much inspired by this visualization. So the idea is basically, can we use these digital footprints apply machine learning to these various data, medical history data, etc. And can we then develop algorithms to identify unique patterns and thereby find and target patients better? So this is what we're basically trying to achieve across many of the work packages in the project. On the other hand, it's not enough anymore just to detect. We also need to do it more precise. So the other dimension to this is to move away from a population approach here, where we do the same for everyone, to do a little bit more precisely in the way that we can stratify populations maybe into a high and a low risk group, and thereby also target our interventions a bit better. So I guess these two visualizations are just really the basic foundation behind the FEMaLe project. To use machine learning to spot various subgroups within a population, and this idea of moving from a population approach to more precision medical approach. So to translate this into the FEMaLe project, we are trying to develop this multi-omic, this platform, trying to combine many different sets of data, and then to basically meet these unmet needs on different levels, on this multi-level I mentioned before. So we have some of the work related to the patient level, and this is where Adrienn and Attila will mention more about the Lucy app a little bit later. But we also have the intention to develop the stratification tool targeting the general practitioners. Can we sort based on a rather simple biomarker? Can we then sort population into a higher low risk group? But also, if there are any high risk, can we then better diagnose and reduce this diagnostic delay currently at stake? And ultimately, we are also developing some new treatments. We are trying to digitalize a mindfulness and acceptance-based intervention called MyEndo. And we are also using this machine learning approach to build a tool where surgeons can actually be visually guided using augmented reality. So this is the way where you put something on top of the visual you see from reality. So it's an augmentation of what's going on. And I guess Attila can also share some more about that. So this is just the framework of the FEMaLe project. So the ambition is to develop this platform, like I just showed you before, that can convert these multidimensional population datasets into a more personalized predictive model to improve the continuum of care for women with endometriosis, or those with endometriosis, I must say, in a more inclusive way here. And the idea is to actually create value, because this way of developing clinical decision support tools can actually enable more shared decision making in both primary and secondary care sectors. And this is a part of personalizing the pathway, like I mentioned before. This is a way to raise awareness. It's increasing health literacy. It's also hopefully also bringing forward more empowerment. So the ultimate objective is to improve quality of life in those with endometriosis. So the project itself, it runs from 2021 till the end of 2024. So we are about halfway. We have been granted almost 6 million euros by the European Commission. And this word cloud was the result of an exercise during our kickoff online meeting in February 2021, sorry. And the consortium members, comprising about 40 people, identified these two key activities needed for us to succeed. So we must keep our enthusiasm, and we must be, collaborating across this project. So these are the two keywords across researchers, business owners, clinicians, etc. And we have 17 partners in total. across 9 European countries, scattered all over Northern Europe, Southern Europe, Western Europe, Eastern Europe. So in that sense, a very widespread project, also across cultures. And we have 10 work packages in the project. So the core activities are research and innovation. So we have one work package exploring how prevalent is endometriosis and what are the socioeconomic consequences of the disease. Are there any, can we find consensus on the symptoms so that we can detect it earlier, etc. So we're looking into these health registers, both in Denmark and in Scotland. That's work package 3, this way of doing the epidemiology of the project. Then we have another work package focusing on genetics to identify these biological subtypes and hopefully to translate these into this tool that can stratify a patient into a high or low risk group, thereby reducing the diagnostic delay. We have a work package 5. This is where the Lucy app comes into the picture. So I'll guess Adrienn and Attila can tell much more about that. Then we have this augmented reality tool developed in work package 6 and 7. So they're closely linked here in the beginning of the project. But this is where we actually collect a lot of video materials, and then the surgeons, to begin with, annotate, they mark on these pictures, and they're using that to train this algorithm to more automatically detect lesions of endometriosis. And that can then be used ultimately to guide live surgeries. Then we have the work package 8, the digital mindfulness and acceptance-based intervention to improve quality of life. There's a lot of psychoeducation going on there, some mindfulness-based exercises. So we are trying to explore if the therapists can be left out, basically, to which degree can this be self-guided. So it's very, very interesting, this, and especially over the past few years, I guess many of us could have used a little bit digital intervention to improve mental health and quality of life. So yeah, looking forward to see what's going about there. But these 6 work packages are like the core of the project, but they are embedded in this framework of responsible research and innovation. So this is where, how can we reflect upon in the project to do our research in a responsible manner? How can we do this to open up the science, the scientific process, so that patients are more actively involved, not only in the end as, testing innovation, but also in the beginning to maybe even define the problems and prioritize the problems. So this is what we're reflecting on here. We are producing some white papers in the beginning of next year to really mark this, how to make healthcare more equitable, how to make it accessible, and especially in the case of endometriosis that doesn't discriminate, then that's really key to put emphasis on. And then we have a work package related to impact monitoring. So what comes out of this? And we have chosen a framework very much linked to the project management of the project with myself in work package 10. So we have applied a new, it's, the fancy word, but it's like a hybrid agile framework. So we are not doing this the classical way. We're really trying to, leave it up to each of these work packages to define themselves. What is the pace that, and the rhythm that they want to establish, and how can we support their work locally? And to do that in such a large project here over so many countries is no easy task, but I think we have actually experimented and succeeded quite a lot with that already. So that's very interesting. So also a lot of innovation taking place in project management this way. And work package 9 here, that's about communication dissemination activities. And this is of course also where we set up all our social media accounts or website of the project, and basically all our public engagement activities. So I'll just mention a few examples about that. So for example, this responsible research innovation, the upper left here is a photo from a workshop we did in Aarhus in Denmark about citizen science. And the bottom left here, it's just a picture for one of our online meetings. Adrienn is also present in the bottom right. And over these first 18 months of the project, we have had a really, really good reach with our social media and communication activities. So, of course, these are not individuals, but we have reached more than 2.5 million with this. So I think that's really, really good. So we have done a lot of different activities, like you can see here in this graph, from translating our research and publications into more publicly available articles. We have been present at exhibitions, at conferences. We took part in this Lady Walk one-day activity in Denmark, walking for endometriosis. So many great activities. And Adrienn will, of course, also, I guess, mention a lot of great examples from Hungary. So this is just to demonstrate that so many great things are taking place in this project. And we have also very strong focus on promoting our research, using social media, promoting our partners. Attila will join us soon. This is an example how we used LinkedIn to promote our publication in the project. A Danish study really documented this underdiagnosis of endometriosis. So that hit the front page in the Danish media that afternoon. So it's just really great way of collaborating across our competencies here to bring forward both research and innovation. Right, so I think that was just a little bit on my side here about the project. You're more than welcome to follow us on the social media accounts we have on LinkedIn, Twitter, and Instagram. More than welcome to also participate on the website we host here. So yeah, just take part in the discussion. And yeah, I'm here to answer any questions, and you're always welcome to pop us an email if you want to as well. I think that's it for me.
Brilliant. Ulrik, thank you very much. Really interesting to hear. I love hearing about female projects, I must say. And I think there's a couple of things, we said an awful lot, but I think a couple of things really stand out to me compared to maybe a more traditional research approaches. Firstly, like you said at the end, you're not just behind the scenes, you're not in an ivory tower trying to do some weird science that somebody's decided interesting. You're like out there trying to raise awareness, trying to make sure people are reached and everything. And linked to that, I know that as the project was developed, and Adrienn was key to this, but others as well, making sure that it was really what was wanted by those with endometriosis. Again, it wasn't just someone deciding they wanted to do this, but working with the community to try and develop things. So thank you for that. We'll take questions at the end if that's all right, because I know that Adrienn's now going to talk to us. So Adrienn will introduce herself. I'm going to give a quick shout out. I've always been hugely impressed by Adrienn's work. She'll tell you about herself, but she set up the Hungarian equivalent of Endometriosis UK and does some absolutely fantastic work over there. So Adrienn, over to you.
Thank you, Emma. Thank you for the introduction. Hello, everybody. I try to share my screen. Yes. Can you see? And here? Nice. So I'm Adrienn Salamon, and when I was 27, I was diagnosed by endometriosis, and I was the first patient in Hungary with deep infiltrating endometriosis to be operated on with laparoscopy by Attila Bokor. So we are in a long related relationship for more than 12 years. Today, I'm a mother of the 2 coolest kids and the president of the only Hungarian NGO supporting women with endometriosis. This was a long journey, but in this presentation or in these few moments, I would like to introduce you the Lucy application. Did you know that 67 out of 100 women never heard about endometriosis before being diagnosed with it? So I think it's absolutely understandable that they have a lot of questions. More than 82% have the common symptom, the painful menstruation. I think when a woman is suffering with endometriosis, know these numbers now. But why is important? Because 1 in 5 women are affected by some type of gynecological disease in the world. Often these disease can only be diagnosed over the course of many long years. in endometriosis, the diagnostic delays could be more than 8 years. It might happen that they try to get pregnant for years without any results. Patients are misdiagnosed very often and therefore not receive effective treatment. We have heard countless heartbreaking stories during these years, and we were thinking about how can we help with our work, maybe. So in this case, hi Attila. You have a few minutes. So we were thinking about how to help to these women, and we made this Lucy application. This application won prizes in Hungary after we present it. And this application is monitoring the risk of 7 diseases. The algorithm was developed under the supervision with Attila to let you know if you should visit your doctor. The algorithm can also recognize disease which might occur in case of problem. And it is able to recognize following the diagnosis you can see on the chart, so not only endometriosis. And in connection with the FEMaLe project, 2 important things that if you download the application and you try to use and fill the data, you can help. So every data can reach to know something about or know more about endometriosis. And also important that we have a survey in this. So we ask you to fill in this survey from month to month. It really helps us. You can use this QR code as well, and our aim is to diagnose the endometriosis in an early stage. It could be very interesting.
Adrienn, sorry to interrupt, and we're still on your first slide. I don't know if you want to move us through your slides.
Sorry?
We're still on your first slide. I don't know if you want to take us through.
Hello, sorry I'm late. I just had a surgery, so I'm just here with you now.
Thank you, Attila. We'll be with you very shortly, and thank you for joining us.
Okay, thank you.
Oh, I don't know what happened, but I think I could say everything. So maybe Attila can follow.
Thank you, Adrienn, and we'll put that QR code out with people when they get them. Attila, thank you so much for joining us. We know that you've just come out of surgery and we appreciate you being with us. So Ulrich has been through about the FEMaLe project, and Adrienn has been talking, as you just heard, about the Lucy project. And we had you down, as well as recovering from being in surgery, for talking to us about sort of a summary of the research and what you're trying to achieve. So can I hand over to you now?
Yes, thank you very much, and sorry again. So what we try to do here within our work package 5, that we would like to decrease the diagnostic delay of endometriosis, which is quite long, as you all know. In Hungary, it's around 4 years, but I assume in Northern Europe is a bit longer. For instance, in Austria or Germany is 7, and in the UK is 6 to 8 years. So I think it's quite a long time of suffering. So between the onset and the definitive diagnosis, this is a huge delay. Our group has been very active on the field of non-invasive diagnosis. We've been trying to find different biomarkers for the non-invasive diagnosis of endometriosis. Firstly, we wanted to develop a test on utopic endometrium back in my Leuven time in Belgium. It was very promising, but we couldn't get it through. So actually, at the moment, it's not working. Nowadays, we're working on different other molecules. For instance, galectin 3, 4, and 9. This is a very promising biomarker from the blood. It's a serum biomarker. At the same time, we would like to focus also on big data assessment. in order to achieve this, we have to collect as much data as we can from all over Europe, and we are very counting on your help, because if we have a lot, like thousands of Lucy users, and they also are able to fill these questionnaires on a monthly basis for 1 year, then we can really collect a lot of data, and we have a good backup from the Technical University from Stockholm, and also from Riga, and these people will help us to assess this data using machine learning and artificial intelligence technology. So what we would like to do, to have a new patient profile, and to have a better understanding of this disease, and also maybe to develop very good and effective non-invasive diagnostic tool. So this would be the major idea.
Great, thank you, Attila. And I think it's worth stressing that one of the things that I'm sure there's lots of people out there who are using various types of menstrual tracking apps. But again, the difference with Lucy is that that data will then be used, I believe, anonymously. That's all sorted, isn't it? But yep, will be used by researchers to then help further the understanding of endometriosis. So it's not being used from a commercial perspective. And I think that's a really exciting angle, really. I know, Adrienn, that started off, but it's now been translated into English, hasn't it?
Yeah, it's already translated. So it's you can just download it from the app stores, and also for Android, and you can start using it.
Yes, it's available in English from the first moment. So, and during the FEMaLe project, we have a dietary and a lifestyle module as well. And there will be a mindfulness module soon as well. So I think it's really very interesting. And women who are using, they are very satisfied with this.
Yeah, that's great. And we've had a question, which is how can we volunteer to take part in this study? And are you accepting patients with more than unusual forms of endometriosis, like thoracic endometriosis? And I think I will hand over to you all to answer that. But I think that, as we've just heard, Lucy is a really good way that everyone can get involved. And that's about finding as many people as possible with as many different symptoms and experiences, so that can all be logged together. Now, being taking part in scientific research is a bit different, isn't it? Because it will be based, certainly if it was in the UK and it is taking part, it depends on which hospitals are being involved. So are there any other ways that people can get involved if they'd like to? Who wants to kick off on that?
Yeah, so we have several collaborating countries already. So we work together with centers from Denmark, Sweden, Germany, Austria, and France, and obviously from Hungary. And we are, I mean, everyone is welcome from the UK as well. So we would love to have you on board.
And no, that's great, thank you. And I think one of the things for me that's really interesting as well, Attila, if I may ask you, is everyone just really wants there to be a simple test for endometriosis, and you talked about blood tests, and I'm sure we all see there's been over the years lots and lots of people going, I've found a blood test and it's never worked. Could you, how are you finding trying to develop that? Because it's a challenging one, isn't it, trying to find something that will actually help?
Yes, I fully agree with you. And the problem is, nowadays you might hear about the microRNA based blood tests for endometriosis, for non-invasive diagnosis. Problem is that we don't know the exact cause, and obviously we don't know the pathomechanism of this disease. So the problem is that we don't know what to catch, what to look for, you know, and that's why it's very challenging to develop such a easy, very reliable non-invasive test, because we just don't understand fully this disease. So I think this is quite a challenge, And that's why maybe with big data and patient profiling, we might have a different approach, accepting that we have some difficulties with the blood test or whatever test we wanted to develop, and we might have here a breakthrough with big data.
Yeah, and I think that's the thing, is it, with big data, because a lot of the studies that we see coming through have been on very small cohorts, very small groups of people.
Yeah.
Difference you're doing is you're really looking at as many as possible, aren't you?
Yeah, that's right. So we are expecting to collect within a year at least 10,000 patient data, but with several entries. So this would be around several hundred thousand entries. So we really believe that by using this, we would have a different insight to this disease.
Thank you. And Ulrich, something you mentioned at the beginning, just to pick up on, is you talked about different types of endometriosis. And I think quite often, you know, it's hard enough, as Adrienn said, trying to get people to understand endometriosis. But I know, and we talk about it a bit like one disease, but I know that a lot of researchers think of, if you like, different types of endometriosis, maybe. Do you want to explain a little bit about that?
I can give it a go, and then I'll leave it up to Attila to go into detail, I'm sure. But I guess it's also the matter of perspective again, right? Because like in the medical field, Attila, I guess, you know, you have various scores for endometriosis, because, you know, that's how you look at the world, and you're being able to classify and all that, right? So that's one discussion about types of endometriosis, that is that you can have different scores. Then of course it can be situated in different places, so that's another way of talking about endometriosis. But as you mentioned, Attila, you know, what's really the puzzle here is that no link has actually been convincingly established between what is actually the mechanism between what. So it's so difficult, because some have maybe deeply infiltrated endometriosis and are not feeling strong pain, while others are more superficially exposed and have great pain. So there are so many variants basically still that's unexplained. So yeah, I guess it's basically a matter of, you know, first of all, like who are we talking with, and from which position and perspective are we talking. But on the other hand, there are so much basic knowledge that still is not well understood. So what we're trying to do here is, with our geneticists, and those are like world-class, you know, Green Sunderland and team in Oxford, Meta professional personalized medicine in Aalborg, is basically to establish this fundamental understanding on the molecular level, and trying to understand the mechanisms, you know, what's going on there on genetic level. How does that translate into medicine? But it takes a lot of time, it takes a lot of resources. And this is one of the problems with the structural problems, that, you know, these sort of tissue are not very well represented in all the biobanks worldwide, because it was very difficult to keep these tissue samples. So we are not getting any wiser looking into there. And the same thing's actually the problem with the health registers, that, you know, they retrospectively hold very, very good information, but since it's such an under-prioritized in research disease, there are some great, you know, delays, and that means that the data is so scattered that it's really difficult to understand what is cause and effect. So this is also why I personally believe this approach with the more prospective data collecting data through a mobile health application, for example, is a great way forward here to overcome these structural problems with our databases, being it biobanks, being it health registers. So I guess that's a little bit, you know, the types of endometriosis discussion, but also like, why do we need this app approach to really drive research further?
And I think, Attila, did you want to add anything?
Yeah, actually, I agree with you, Ulrich, and this is a major question. Not only the different phenotypes being of superficial or peritoneal disease, or ovarian or deep disease, but also the perception of this disease, because we are also looking at central sensitization among patients with endometriosis, because we have this very, very solid data on the different pain symptoms in endometriosis, and we see that sometimes the extent of the disease is not correlated with the pain caused. So therefore, we would like to understand the different perception of this disease, and we will use among our questionnaires the central sensitization inventory, which is a very easy, very simple questionnaire assessing the central sensitization among these patients affected by this enigmatic disease. So we're really looking forward of the data.
Thank you. That's really interesting to hear that. Now, one of the other questions is, and I don't know who's going to start off on this, Adrienn or Attila, but we've been asked that we'll obviously the Lucy link, we'll send that out, and Adrienn's put that out now, and we'll send it out in a link. But if you've already been diagnosed with endometriosis, how will the Lucy app help, or does it help?
It doesn't help. We advise you to go to see your specialist.
Yeah.
So this is not a diagnostic tool. So this is just a simple engine and a simple questionnaire in order to have a better picture. This is just a puzzle in this big picture.
Adrienn.
Yes, sorry, but I think she's asking that if she has already been diagnosed, how can the application help? And I think in different ways, because you can use the dietary and also the lifestyle module, which can help your days, and also can help that you can follow your symptoms for month to month, and you can show a summary to your doctor also.
Yeah, maybe for follow-up, it may help, but it's not for diagnosis. Okay, so this is not a diagnostic tool yet.
Yeah, and someone's asked, is the Lucy app for everyone to use, whether they know they have endometriosis or not?
Yes.
Yeah, it makes sense. Yeah.
Yeah. And so again, I mean, one of the great things about it is that the aim is that it helps you with tracking your cycle, and it has, as Adrienn says, it has various information in there, but equally it will help, well, it won't help you directly, it will help collect data which will help the future generations get diagnosed as well. So we can do that. And if you've not got a diagnosis of endometriosis, but you might have some of the symptoms, and again, that can help with sorting out your understanding of what those are. So that's great. Oh, there we go. And I think that one of the things, Adrienn, I mean, you've been working on this for, well, you've been working on these sorts of ideas for many years, but with this for the last 2 years. In terms of how do you feel it's been working in such a big European consortium? Have you found it?
You mean our awareness work, or I can't really hear you?
Sorry, I mean, I've been as part of FEMaLe, because you're taking part in a European level project. How have you found that?
Yes, I think it's very interesting, because a lot of researchers are ongoing, and a lot of you can find in the world. But I think in this project, not only the partners are working on this, then any other partners or people can support the project, like you with this webinar. And I think this is, for me, this is the best thing and the most fantastic thing, that a lot of people are working together to help women with endometriosis.
No, and I think, and again, Ulrich talked about it earlier and might want to say something else, but I think one of the things that's really great is it's such a wide-reaching project based on what it is, the endometriosis community that was surveyed wanted. But also, as Attila's discussed, it's also about really trying to find answers. Quite often research on things like biomarkers, and I'm very generalizing here, but if they're done by, you know, people who are trying to make their own product for themselves, then, you know, it can be looking quite narrow. But I know what you're trying to do is work really collaboratively and broadly. And how do you find it, Ulrich? Because obviously it's a project you're managing, quite a big project.
Yeah, it's been so rewarding, and I'm learning something every day, really. I guess I've been in other projects before, of course, but what's really striking me, it's very particular for this, is that the community around endometriosis is so giving. So you know, everywhere we turn, I guess we're being supported. Also in Denmark, you know, we haven't got the Danish Patient Association on board as such, but we have collaborated so closely, like with this campaigning, the Lady Walk initiative we did, and now we are actually doing some research about the impact of such campaignings. And, you know, just all the participants within a day signed up and said, of course, we consent to help you if this can, you know, increase awareness and improve research knowledge. So I guess that's basically, I'm very flattered. I'm very humble about that, you know, that this good vibe and you know, all the high hopes for doing making a difference is really there. And then also this movement across borders, you know, there's such a collaborative spirit, and it's not only in Europe, you know, it's also overseas. I see we've done it from Australia with us now, you know. We have also been in contact with great people in the US and Canada, etc. So I guess also like this, it's so rewarding to take part in this movement, and just pushing that forwards in this project a little bit it's yeah, very, very meaningful, I would say. But of course it's also challenging, and we, you know, started this up during COVID with not being able to meet physically and all that, but ultimately, you know, it's so interesting.
Yeah, and I think as people have talked about that real collaboration about trying to find data, trying to find the information that's needed and sharing that is so important. And you know, we talked about how there's not that much data. I know one of the issues we sometimes have in the UK, for example, is that people's records don't say when because you don't know until you've got a diagnosis, you don't know what it is. So it's quite hard to see what the symptoms were unless you track back and do quite a lot of work. And I know there's a whole range of things you're doing. Thank you for that. Now we're going to come to a close in a minute, but I just was going to go around and ask Adrienn, Attila, and Ulrich if there was anything else they wanted to say at this point before we say goodbye. So Adrienn, anything you wanted to add?
Yes, that you should know that painful menstruation is not normal, and please download the Lucy application and fill out the survey.
Thank you very much. Attila, anything you wanted to add?
For me, yes, thank you for the opportunity. And also we are really counting on your help. And I think if you are able to raise the awareness about our project, it will be very important. And I really believe that this will be a real added value to the endometriosis research. So we are really happy to contribute.
Thank you. And Ulrich, anything to add?
I think I'm just contemplating on here that you have done so much great already in the UK, but the way you can help us is like Adrienn and Attila mentioned here, to download, to use the app, to engage with us on social media. That really helps a lot. On my behalf, as coordinator of this project, I would just really like to learn more about how you have put forward some of your concepts. So if there are anyone also taking place here that would like to share that, or if we can run another webinar about, you know, some of your take-home messages and some of your great concepts that you have really successfully introduced, like to have endometriosis-friendly employees, etc. I think that could be amazing to translate and to introduce in other countries, because we're just starting that conversation with policymakers in Denmark. You're doing a great job in Hungary, I know, but like I would really love if FEMaLe could also be a knowledge hub and, you know, a project of exchange where we can also learn from you. So how can we reverse this innovation. I would love to learn from you as well.
Thank you. Well, I've just seen a message from Donna. Donna's down in Australia, and I know they're also doing a lot of work on employment as well. So I'm sure we'll all join together.